Distinguished guests, ladies and gentlemen, a very pleasant afternoon to you all. And we would like to extend a very heartfelt appreciation to all of you for joining us at the 2024 World Bio Summit special session. My name is Kelly Park, and it is with great honor and great pleasure to be guiding you throughout today's proceedings. It is an honor to meet you all. Thank you very much. Now, this year marks the third annual World Bio Summit, centered around the theme, Future Investment for a Healthy and Secure Decade, taking place today and tomorrow. Now, organized by the Korea Disease Control and Prevention Agency, this special session of the World Bio Summit will be focusing on activation of immunization for a safe and healthy future. Now, today's session will be featuring an opening ceremony, presentations by 3 international organizations, followed by discussions with speakers and panelists. Currently, we are streaming live on the official YouTube channel of the World Bio Summit, so we encourage you to tune in and stay with us till the end, and hope you take home lots of thoughtful and fruitful exchanges back home. So without further ado, let us now officially commence the opening ceremony for the 2024 World Bio Summit special session. Now, to kickstart this meaningful occasion, it is with great pleasure to present the opening remarks by Mr. Chung Il-kung, Director General for Healthcare Safety and Immunization at the Korea Disease Control and Prevention Agency. Please welcome him with a big round of applause.
네, 한국어로 하겠습니다. 네, 안녕하십니까. 질병관리청 의료안전예방국장 홍정익입니다. 2024년 세계 바이오 서밋과 같은 매우 의미 있는 자리에서 예방접종을 주제로 한 특별 세션을 시작하게 되어서 무척 기쁘게 생각합니다. 먼저 오늘의 소중한 논의의 장을 만들어주신 보건복지부, WHO, 그리고 여러 2024년 세계 바이오 서밋 개최 관계자분들께 감사를 전합니다. 특별 세션의 연사를 맡아주신 가비의 파이자 길라니 국장님, 유니세프의 킨 데비 아웅 지역 건강 전문가님, WHO의 로렌 프렌잘 IBB 부서장님과 패널 토론 좌장을 맡아주신 정희진 교수님, 라이트 재단의 이운상 이사님, IBI의 앤서니 후사르 국장님, 그리고 특별 세션 개최를 위해 열심히 힘써주신 모든 관계자 여러분들께 깊은 감사의 말씀을 드립니다. 바쁘신 와중에도 참석하여 자리를 빛내주신 내외 기빈 여러분께도 진심으로 감사를 드립니다. 이번 특별 세션에서는 안전하고 건강한 미래를 위한 예방접종 활성화를 주제로 다음을 논의하고자 합니다. 먼저 가비 6.0을 소개하여 공평하고 지속 가능한 백신 활용 확대 방안을 공유하고자 합니다. 다음으로 WHO IA 2030과 유니세프의 이뮤니제이션 로드맵 to 2030의 핵심 목표 중 하나인 백신 접근성 및 형평성 제고 전략을 공유하고자 합니다. 그리고 생애 주기 예방접종의 중요성과 전략을 여러분들과 함께 공유하고자 합니다. 마지막으로 모든 연사분들과 여러 패널들이 함께 건전한 백신 공급망 형성을 위한 국제적 협력 방안을 논의하고자 합니다. 다시 한번 이 자리를 위해 힘써주신 그리고 참석해주신 많은 내외 기분 여러분들께 감사드리며 질병관리청장님의 환영사 영상과 함께 특별 세션을 시작하도록 하겠습니다. 감사합니다.
Good afternoon, distinguished guests, ladies and gentlemen. I'm Young Mi-ji, Commissioner of the Korea Disease Control and Prevention Agency. I'd like to welcome you all to the special session on immunization for a safe and healthy future, organized by Korea DCA as part of 2024 World Bio Summit. I'd like to express my deepest gratitude to Dr. Faisal Jilani from Gavi, and Dr. Kin Devi Ong from UNICEF, Dr. Lauren Franzel from WHO, and Professor Hee-jin Jung from Korea University Hospital, and all panelists who have spared their time to join this special session on immunization. This year marks a historic milestone as we celebrate the 50th anniversary of WHO's expanded program on immunization, EPI. Indeed, this year's World Health Assembly provided an invaluable opportunity to reflect on critical role of vaccines in public health. Gavi and UNICEF, as essential players in EPI's legacy, joined this occasion to honor this milestone event. I was also privileged to make a short statement in this event. Over the last 50 years, EPI has saved an estimated 154 million lives, on average of 8,000 lives each day. Today, as we look back, we are also inspired to look forward, especially given the lessons learned from COVID-19 pandemic, which reinforced our understanding of life-saving value of vaccines. We can all agree that immunization remains one of the most effective public health interventions. In many developing countries, EPI plays a vital role in strengthening the public health systems. The KDCA has made the full efforts to expand the national immunization program, ensuring that people of all ages across generations benefit equally from vaccines. Currently, KDCA supports immunization against 20 infectious diseases targeting children, adolescents, pregnant women, and the elderly. In addition, we achieved a full immunization rate of 89.8% for 6-year-olds in 2023, marking Korea as a leading country in the immunization coverage. However, we recognize that the success of immunization program should not be confined to individual countries. It is a shared global responsibility. We must work together to ensure that no one is left behind. Despite our collective efforts, approximately 14.5 million children worldwide did not receive even a single dose of the DPT vaccine, one of the basic immunizations, in 2023. This figure is a clear reminder of the work that remains. Now I can assure you, Korea remains committed to addressing these global immunization challenges through fostering international cooperation. In December last year, Korea DCA launched the Global Health Security Coordination Office, GISCO, to further our global responsibilities, aiming to strengthen regional and global preparedness and response capacities for infectious diseases. KDCA also continued to expand partnerships with key international organizations, including WHO, CEPI, IVI, and national public health organizations such as US CDC, NIH, UK Health Security Agency, Singapore CDC, and many others. Thanks to these concerted efforts of international organizations and countries, platforms such as the 2024 World Bio Summit and today's special session are accelerating global cooperation. Now is the time to unite in our shared vision to ensure a safe and healthy future for every precious life around the globe. I do hope that discussions during today's special session will advance our efforts. I very much look forward to presentations on new Gavi 6.0 covering climate change and immunization, and UNICEF addressing leaving no one behind, as well as WHO's insight on life course immunization and the outcome of panel discussion session on vaccine supply chain chaired by Professor Jung. Once again, I'd like to convey my sincere gratitude to all speakers, chair, panelists, and all participants. I wish all of you a very productive and successful meeting, and let's work together to build a healthier world for all. Thank you.
Big hand. Yes, we sincerely thank Director General Hung and Commissioner Chi for the thoughtful remarks, as well as your leadership and support for making this event possible. Ladies and gentlemen, please give another big round of applause. With this, we will conclude the opening ceremony and proceed right to our special session. The first presentation will be given by Mr. Faisal Galani, Director for Africa, Asia, Latin America, and the Middle East Resource Mobilization and Growth at Gavi, the Vaccine Alliance. Please welcome him with a big round of applause. And he will be presenting on the topic, Introduction to Gavi's 6.0 Strategy, Protecting Our Future Through Immunization.
Thank you. It's an honor and pleasure to be here today, and thank you for this opportunity to walk you through on Gavi and our next strategic period of 2026-2030. So very briefly, what is Gavi? Gavi was born in 2000 when there was inequities in vaccination among low-income countries, where vaccine manufacturers did not prioritize vaccine for low-income countries and focused more on high prices and high-income countries. So 4 alliance partners came together, WHO, UNICEF, World Bank, and the Bill and Melinda Gates Foundation, to find a solution to reach with low-income countries with equitable access to vaccine. So what is the model? Gavi, I think this is one of the best slides we can, even if we illustrate on this slide, we don't need to go further. So Gavi look at the long-term funding from donors. We pool vaccine demands from countries, help countries with strengthening their health system, and scale up vaccination. So when Gavi was launched, we had very low coverage around the world, and today a child born in Gavi-supported countries is 70% less likely to die from a vaccine-preventable diseases before their 5th birthday. So how does it work? So Gavi initially started supporting 78 countries, low-income countries. We pooled their demand, vaccines demand. We went to the manufacturers with long-term predictable manufacturing of vaccine and assured financing, and help scale up vaccination in low-income countries. One of the key pillars of Gavi is to shape vaccine markets. When Gavi was launched in 2000, we had only 5 vaccine manufacturers around the world, and one of them was in Republic of Korea. And today, as we speak, we have 19 manufacturers in 12 countries around the world, and 10 of them are in Asia, and 2 of them are in South Korea. So it helped drive the prices down, so countries had access to affordable prices. So in Gavi model, one of the key feature is sustainability and co-financing. Truly, Gavi is not a charitable, but mostly an empowerment model, where we engage countries to finance some of their costs. For low-income countries with per capita income less than 1,085, they contribute 20 cents for each vaccine that they deliver to the country's EPI system. And when their income grow, their contribution also grows. And when they hit $1,810, they enter into the accelerated phase of transition. So as we speak, we have reached 1.1 billion children around the world in last 23 years. saving or averting deaths of 18.8 millions, and including 2.7 million lives saved through COVID vaccine, which was delivered to 146 countries, 2 billion of doses. So through this support over the last 23 years, Gavi has also supported countries which generated $220.5 billion in economic benefits. And as we speak, 19 countries have transitioned out of Gavi support. And 10 countries are in accelerated transition phase, and they're leaving over the next few years from Gavi support, and to completely finance their own vaccination. So Gavi 6.0, we are currently in 5th phase of Gavi's strategy, and we are entering into the 6th phase we call Gavi 6.0, 2026-2030, where we are aiming to reach 500 million children over the next 5 years. During the last 22 years, or 23, we immunized 1.1 billion children, and now we are doubling this impact by immunizing 1 billion over next 10 years. And during next strategic cycle, we will immunize 500 and averting the deaths of about 8 to 9 million children. During this phase, countries' co-financing will also reach to 4 billion as we speak. Currently, it's about 1.7 billion. We are also preparing ourselves and countries for the outbreaks. We are planning to tackle or address at least 150 outbreaks around the globe. We are also immunizing about 50 million children for malaria vaccine, which is one of the newest vaccine Gavi has launched in Africa. So when we started, Gavi had only 6 vaccines or vaccines against 6 diseases in 2000 and 2001. And as we speak, during our current strategic period, we have over 20 vaccines supporting countries, low-income countries. And over the next period, we are introducing 4 new vaccines, so reaching to 24 vaccines in our portfolio for our next Gavi 6.0 strategic period. So to achieve these targets, these milestones, we are looking at $11.9 billion to support our program over the next 5 years. With vaccines will be around 6.6 billion, and investment in the immunization and health system strengthening and operational expenses will be about 5.2 billion. So as we speak, we already have raised or secured 5.8 billion through assured resources. We have this international finance facility for immunization, where we had long-term commitments from donors, which we convert into vaccine bonds and trade in capital markets. So that gives us flexibility and future or cash front loading to address some of the challenges we face. For example, when Ebola struck in 2014, it was through this facility and flexibility that Gavi was able to invest $25 million in vaccine production to support the Ebola program. So we have assured resources of 2.9 billion, and we have new pledges already. US, Spain, France, and some other donors. European Commission have already pledged resources for our next cycle, and currently we are at about $5.8 billion. So Republic of Korea was the first donor from Asia with $1 million contribution in 2010. And as we speak, for current strategic period, including support to COVID vaccine or COVAX, which is $310 million we have from Korea, making it the 14th largest donor among Gavi's donors community. We also have, we procure vaccine from South Korea. It's 11th, it's the 4th largest vaccine provider to vaccine. And overall, 11% of vaccines are procured from Korea, and 88 million doses were procured in 2023 alone. We roughly spent $100 million for procurement from Korea, and in last 11 years, we have invested $910 million procuring vaccine through three main manufacturers, EU Biologics, LG Chem, and SK Biosciences for COVID-19 vaccine. I must say that for oral cholera vaccine, about 99% of our global procurement comes from South Korea. So Bill Gates, as you know, is one of the founding father. It was his concept. And if we're proud to share this quote that people sometimes ask me to name the best investment I have ever made. The answer is simple. It's Gavi, the Vaccine Alliance. And so we are proud to have Gates Foundation as our alliance partner, and they help us in a number of ways around our work. Thank you for your time and attention.
Thank you, Mr. Galani, for that insightful presentation on Gavi's 6.0 strategy. It was very inspiring to see how Gavi is setting the stage to address future health challenges through robust immunization initiatives. Thank you once again. And next, we are very honored to have Ms. Kin Devi Aung, Regional Health Specialist for UNICEF East Asia and Pacific Regional Office, who focuses on immunization and health systems. Please welcome with a big round of applause. And she will be presenting the strategies for enhancing vaccine accessibility and equity.
Thank you very much. Like Faisal, I'm also very honored, and it's my pleasure to be invited to speak at this special session on immunization. So I'll be talking about strategies for enhancing vaccine accessibility and equity, known as leaving no one behind. But first, I would like to talk a bit about UNICEF. UNICEF globally works in over 190 countries on many issues, and immunization is one of the core ones. Specifically in the East Asia and Pacific region, where Korea is situated, we work through 14 country offices in these countries. In the Pacific Island countries, there is one office who looks after the 14 other Pacific Island countries as well. And in Malaysia itself, our country office actually looks after Malaysia and Brunei Darussalam. Now, talking of leaving no one behind, let's look at the immunization coverage globally. And I will talk about this through the lens of zero-dose children. So a zero-dose child is a child who's never received a single dose of DTP-containing vaccine. And we talk in Immunization Agenda 2030 with a focus on zero-dose children. And the indicator for that, the proxy indicator, is looking at the DTP1 coverage. So if we look at the coverage in 2023, the DTP1 coverage, there were 140 countries that achieved coverage more than 90%, which is great. But there are 10 countries who achieved less than 70% coverage. That is a lot of children who's never received a single dose of even DTP1, DTP vaccine, penta or pentavalent or hexavalent vaccine. And if you think that they haven't received that vaccine, then what about the other vaccines that come afterwards? They likely will not have received those vaccines as well. We did make progress since 2000. In 2000, there were 22.8 million children who didn't receive a single dose. In 2023, 14.5 million. So that's an achievement. But we have a long way to go because according to IA 2030, our goal is to reduce the number of zero-dose children by 50% by 2030. And we are off track. If we look at the East Asia and Pacific region, our DTP1 coverage is 5 percentage points below that of the pre-pandemic level, below 2019 level. We still have not caught up with the vaccine coverage. That means that in our region, 1.8 million children have missed out on vaccination with DTP1, DTP containing vaccine, but also other vaccines. The DTP3 coverage in the first year of life, so 3 doses of vaccine, there's actually a decrease of 6 percentage points, similar to measles containing vaccine, also 6 percentage point decrease from 2019. So we have a lot to do. There are many reasons for children missing out, what we call bottlenecks and barriers to immunization. And we can look at this through the lens of supply and demand side. And on top of that, globally, there are also conflict and fragile settings. When we look at it from the side of the supply side determinants, we need to think about the availability of the health facilities. There isn't enough. Are they close to the communities that they are serving? We can think about the infrastructure. What does the health facility look like? We need to think about the staffing. There is insufficient number of health workers there, and also we need to think about their capacity. Have they been well trained? Budget. Is there enough budget for vaccine procurement, let alone other necessary commodities? And also the number and quality of the vaccines. You need to have sufficient number of vaccines, and the vaccines need to be good quality. That means putting that in the cold chain system that functions. What about budget allocations subnationally where the health workers have to go out and vaccinate people, children, adolescents, elderly? And we look at the demand side determinants. What does the caregiver think? There is increasing vaccine skepticism and hesitancy, and particularly after the COVID-19 as well. So it's not just a question of what information are they receiving, what misinformation are they receiving on social media and others. We also need to think about what their service experience is like. When they go to a health facility, do they get good experience? Are they turned away? Do they have enough information? Will they be tempted to come back for vaccination? And then the integration of services. Will they be getting other services apart from vaccines? Is it really worth it for them, worth their time, worth the cost? We have to make it worth it for them. And conflict and fragile settings, of course, there's the health facilities, health infrastructure, there's disruption, there's destruction, and the difficulties in identifying the target population when there are internally displaced populations, when there are migrants, and also difficulty in security and getting access to this population. Fragile supply chain system. So all these add to the complexity of already the bottlenecks and barriers that exist in a health system. So UNICEF has developed an immunization roadmap for 2030, and we're committed to reaching global immunization goals, which align with the IA 2030 and Gavi strategies. So the first one is really on catching up with the vaccination, those children who missed out during the pandemic, and then leaving no one behind, leaving no child behind with the vaccination, and then strengthen and sustain the systems. UNICEF has also developed or released the State of the World's Children report focused solely on immunization as we came out of the pandemic. And this was a report from 2023. And it says that the story of unvaccinated children, which is the zero-dose children, is one of underinvestment and inequities. There is an underinvestment in primary health care. Many of the zero-dose children live in conflict countries. And 23.5% of the children among mothers who have no or low education. And they're usually found in the poorest households. And it also depends on the ethnicity and minorities. The zero-dose children are usually found in these minority and ethnic population. So it is it's a story of deep-seated system challenges. As I mentioned earlier, there's a shortage of healthcare workers, limited access to the essential supplies, including vaccines. We still have countries in our region that have stock out of vaccines. So we're talking about procurement, we're talking about budget, having enough vaccines to be able to vaccinate children. And there's poor engagement of communities, which becomes even more important in this day and age of vaccine hesitancy. There's lack of integration with other services, including primary health care and non-health services. And there's a weak capacity for collecting and using data for action. So we must do more, we must do better, and we must do it now. And for UNICEF, the key areas of action we have been working on and we will continue to intensify our efforts on is to vaccinate children everywhere. Find where the zero-dose children are, get the vaccines to them, strengthen the demand, the vaccine demand, and bolster the vaccine confidence. This really looks at working on the social listening piece, social media, addressing the concerns that the caregivers have. And spend more and better on investment, immunization, and primary healthcare. I mentioned earlier, you really need a strong primary healthcare backbone to provide these services to the children and adults and the elderly. So we need to start spending more on primary healthcare. And we need to build resilient systems and invest in new approaches. Resilient systems. When we think that we have solarization of cold chain, and now we're going beyond and looking at solar electrification of health facilities. What about the healthcare waste? All those generated in health facilities. We need to look at greener, sustainable healthcare waste management. We need to look at innovations and leverage all the advances that were made in technology to make it simple for health workers to deliver the vaccines. Thank you very much.
Thank you, Ms. Sung, for sharing such great viewpoints. The presentation has truly highlighted the crucial role of equitable access in building stronger and healthier communities across East Asia, the Pacific, and beyond. Thank you once again. And last but not least, it is with great pleasure to introduce Ms. Lauren Franzel, Unit Head of Vaccine Alliances and Partnerships at the World Health Organization, with over 20 years of global health experience. Ms. Franzel coordinates collaboration with WHO, Gavi, and partners, and she'll be presenting on life course vaccination, how to better reach individuals from childhood to elderly. Please welcome with a big round of applause.
Thank you very much for that nice introduction and sending you my greetings for this afternoon. It is a pleasure to be here, and also thanking the organizers of this fantastic summit. So as was just mentioned, I've been invited to speak about life course vaccination, and we're going together to be looking at how we're vaccinating infants and children, adults, all the way to the elderly. So we'll do this together. But before we do that, I wanted to also set the stage. This is a very important year for immunization. It marks 50 years since the World Health Assembly put through a resolution to form the essential program for immunization. And I just wanted to remind you the impact of this topic. This is a public health intervention that has saved, we did an analysis this year, 154 million lives. So 154 million deaths have been averted in that 50-year period. So this is a tremendous achievement. And now today together, we'll be looking at how we can expand that benefit, not just to infants and children, but really across the life course. I do want to say that during that 50 years, it is estimated that there was a 40% reduction in infant mortality directly attributed to immunization. So this is by far one of the most impactful health interventions we could imagine. So let me start with that. So I've been asked to speak about the how to better reach individuals across the life course, but before doing that, I want to speak about the why. So I think we would all agree that we have a right to health across our lifespan. So a life course approach is what's needed to ensure that humans are protected from vaccine-preventable diseases across their life. We also want to build delivery programs. We just heard my colleague from UNICEF talk about what's needed to strengthen the immunization programs that exist in the context of a primary health care approach. But we really have an opportunity to not just build the immunization programs, but do so in the context of the full health program. And I'll say more about that as we go. And then finally, the why comes down to an effective life course vaccination program can help improve the opportunities so that everyone is benefiting from longer and healthier life. And another point that I think is really important to factor in as we think about expanding immunization across the life course is that we're living longer. If you were at the opening session, my colleague from the White House mentioned that in Korea, I think it was in 1950, the life expectancy was incredibly low. I looked online, I think it was 35 years according to the site that I visited. Today it's almost 85. So we're living longer. For the first time, there are more people above 65 years than under 5. I also want to mention that when we see the emergence and reemergence of diseases, we often need to implement life course vaccination for pandemic response. So this is a really important element and a reason why we need to be looking carefully at vaccination across the life course. That relates to health security and pandemic preparedness, and then of course a need for countries to invest more on prevention rather than just care. So I hope that helps to explain a little bit along the why. Now we have a fantastic opportunity. In 1974, when EPI was set up, there were only 7 vaccine-preventable diseases. And today we're looking at 13 globally recommended vaccine-preventable diseases for which vaccines exist and are available, and then another 18 that are meant to be used in specific contexts. So we need a platform for these interventions to be rolled out and reach individuals, protect health, and this is especially important in settings where access to curative care is limited, and also where vaccine-preventable disease detection is weak and outbreak response might also be weak. And as we look into the clinical pipeline, so Korea is a hub of clinical research and development, but as we look at the vaccine pipeline, you can see in this slide, in the recently licensed category, in late-stage development, phase 3, phase 2, phase 1, the bolded vaccines are all of those that are meant to be used in an adult vaccine portfolio. So we have a really important opportunity as we look ahead to protect health through developing a life course platform. So I hope that helps to set the stage a little bit about the why. And the other really important contextual piece, and my colleague, Dr. Devi, mentioned the IA 2030, which stands for the Immunization Agenda 2030. We have a strategy that allows us to do this, that gives us the mandate to do this. So I won't spend too much time on this slide, but what I wanted to just state is that the vision for IA 2030 is very much at the crux of life course vaccination, that we protect everyone, everywhere, at every age. So we have a mandate in our strategy to do that. And one of the goals of IA 2030 relates directly to life course and integration. And we have several objectives, specific objectives that relate to policies and service delivery that enable life course delivery of immunization, and also that we're delivering and developing additional points of contact for immunization across the life course, as well as other public health interventions. Now, as we look at this together, the other element is, how does life course vaccination relate to disease elimination and control objectives? So if you look at some of the control and elimination strategies that WHO and partners have developed, we have tetanus, which is, of course, vaccination during pregnancy and beyond childhood. We have vaccination at birth related to hepatitis. We have cervical cancer in adolescent years, the HPV vaccine to protect us against cervical cancer, and numerous other examples of why it's important to not just vaccinate young children and infants, but really to protect across the life course so that we are moving towards the elimination of these diseases. And the other element around the why is around the benefits. So I have a couple of examples of the benefits that I want to walk you through. And of course, immunization protects the individual. I think all of us appreciate that. But what it also protects is the broader society. It's a intervention of care for a broader community rather than just at the individual level. So having immunization across the life course further enables us to protect a broader society and a community. And then, of course, when we look at the health system specifically, immunization is a fantastic way to reduce the burden on the health system of curative care. So for example, as countries are rolling out the dengue vaccine, we expect to see dengue, the case burden of dengue and patients presenting with dengue at hospitals, which can rapidly overwhelm a hospital, to be reduced. And so we're protecting the health system by rolling out these life course immunizations. Next, I want to talk about the evidence related to the economic benefits. So many of us are working with ministries of health, but ultimately ministries of health need to convince their ministers of finance as well. And so as we look at broader life course immunization, it's really important to have that economic evidence as well. So this slide is giving you insight into just 4 vaccines. So this is looking at a study of influenza, RSV, herpes zoster, and pneumococcal disease. And so 4 vaccines studied in 10 countries. And what the study found was that there was a 19-time return on that investment and a savings of up to almost, let's say, over $4,600 per full vaccination course. So there is a tremendous opportunity for economic savings as well, if we are to really lean in on adult immunization. So that's a bit about the evidence that exists. The next thing that I want to talk to you about, we're soon getting to the how, but first I want to talk to you about equity. As we look across the 6 WHO regions, and also the top line here is on the global coverage, you can see how inequitable the coverage of adolescent, adult, and older adult data is for vaccine coverage. So many countries and many regions are doing quite well. There's still a lot of gaps in some settings, but the infant immunization across the 6 regions is pretty well developed with some remaining gaps, as Dr. Devi has described. But then when you look to the outer ages, you can start to see that it really gets to be very variable, comparing, for example, the European region against some of the other regions. And then if you look at the bottom part of this slide, this is breaking the the data down further by economic strata. So you can see with the lower blue rectangle how inequitable the current immunization programs are vis-a-vis adult vaccination and adolescent, and also for elderly adults. So there's a lot of work to be done on expanding life course vaccination across these age groups. The next slide is building on that theme as well. So if you were to look at just the universal recommendation for every stage, this is on the left side, it's the purple color that is calling out just 24% of countries are actually following a universal recommendation. Meanwhile, and you can see just glancing at the purple color where those are. They're generally in high income settings. And now looking at the right-hand side of the slide, in the blue, this is 63% of countries that have universal recommendations for older adults. So you can see, again, there's quite a problem with equity as we think about life course. And as the title calls out, African and Asian countries are lagging behind. So now let's get into the crux of the how. So in the materials that are shared in your packet, there is included the WHO recommendations for vaccination. It's summarized here on this slide. The top half are the global recommendations, and then the bottom half are the list of the selected characteristics. And what's being described here is how these vaccines equate or relate to different stages of life. So you can see we have opportunities across the life course. So now I want to go a little bit into how these programs might look across the life course. And I want to start with a notion around how we may deliver these vaccines vis-a-vis an integrated package of services. So I really like that this slide calls out different areas of health systems work and different disease control initiatives. So across the top, you have non-communicable disease screening. So this is an opportunity to screen while you're delivering vaccines, especially for adults and the elderly. You also have opportunities to provide health promotion communication, interventions around hygiene, HIV services in settings where that's possible, reproductive and maternal health services as well. So this is, of course, across part of the life course. This slide also calls out opportunity for integrated delivery of vaccines with neglected tropical disease control, malaria control, as well as advice for nutrition. So we have a tremendous opportunity here to deliver vaccines alongside these other health platforms. And increasingly, we're seeing countries taking advantage of these opportunities. So we'll look at that together a little bit more in depth in a moment. This slide is looking at our coverage among infants and children and how we're going vis-a-vis the IA 2030 goals. It was actually Dr. G in her recorded video that called out that we're actually quite off course. Presently, there are just over 14.5 million children who are considered zero dose. And that number is actually larger than the number in the baseline year of this Immunization Agenda 2030. 2019, we had 12.8 million zero-dose children. So we're meant to be reducing zero-dose children, and yet globally there are more zero-dose children now. So we need to come up with some solutions. And so what's happened in the past few years is this idea of the right to catch up and the right to vaccinate children who have missed their routine immunization. And so we and partners have been working with ministries of health to really change from a policy perspective. Many countries once had perhaps a catch-up policy that speaks to under 2-year-olds. And now we're seeing countries move to any child who is not fully vaccinated under the age of 5 can and should be vaccinated. So we're really excited to see this policy shift, and we think it's a really important opportunity to close immunity gaps and fully protect children and infants from VPDs. So let's keep going. So that's infants and children. The next lens has to do now with children and adolescents. So we're moving across the life course. So this is a recent publication from WHO that looks at the touch points that exist across early childhood and into adolescence. And you can see on the left-hand side all of the many touch points that exist where we can bring in immunization and also those other programs that I mentioned. And this is now looking at what opportunities exist specifically related to school-based vaccination programs. So you can look at screening interventions, you can look at commodity that could be provided, and then you can also consider other life skills that could be introduced when you're engaging with children and adolescents, delivering vaccines, but for example, also providing sexual and reproductive health messages. So we have a great opportunity here, and we're working together with UNICEF and governments and many other partners to do just that. So that's one example. The next example that I wanted to give you is also a little bit further out the life course, which is maternal immunization. And maternal immunization, here on the slide it's written as 3 times 1. It's actually really a 3-in-1 benefit, because when you vaccinate a mom, you're vaccinating that woman, you're vaccinating the unborn child, protecting that child, and you're also protecting the neonate because of the immunity that can be passed from the pregnant woman to the infant in their first months of life. And so we have a fantastic opportunity to go further on maternal immunization. We have tetanus, we have pertussis, we have influenza, and of course COVID. So there's a lot of opportunity here to go further on vaccinating expectant mothers and protecting themselves, the fetus, and their unborn and their child once it's born. Now we're going to move to adults. So one of the flagship adult vaccination programs is influenza, which is widely used around the world. And on the slide is the burden of influenza, but what I really wanted to talk about was WHO, looking at the data, looking at the evidence. We really strongly recommend that countries are considering how they're implementing their seasonal influenza program and targeting it. So you have 4 priority groups, and this is a pretty widely rolled out program, especially in middle and high-income countries, but reaching and protecting healthcare workers, reaching and protecting individuals with comorbidities, older adults, and also pregnant women. So another opportunity, and getting into the how as well of rolling out life course approach to vaccination. The next element has to do with the elderly. So of course, many countries reached elderly with the COVID vaccine. Very high coverage indeed was reached because of the priority that was placed on reaching elderly with the COVID vaccine, but also influenza, as I've just mentioned, pneumococcal vaccines, as well as herpes zoster. So a big opportunity here to go further in reaching elderly. And there's a couple of examples. I'll just speak to the one example, which is from the region. In Cambodia, the adult vaccination was integrated with other services. So when the COVID-19 vaccine was rolled out, it was done so also with a screening effort for non-communicable diseases. And so this is a really useful model. And of course, this is a low-income setting, so a low-resource setting where integrating vaccines and screening can really be a useful model to follow. The next example is related to healthcare workers. So health workers have 11 vaccines that have been recommended to protect them. Of course, they are exposed to quite a lot of different viruses in their work. And so we've called out some of the bottlenecks that prevent countries from effectively reaching healthcare workers. And we also have, as is featured on the slide, clear guidance for how to implement programs to reach healthcare workers and protect them from vaccine-preventable diseases. So a lot of good material exists so that countries and WHO member states are able to go further in expanding the life course reach of immunization. Now, I'm excited to look ahead as well before I conclude. We have a BCG vaccine that prevents and protects against tuberculosis. But what we're also really looking forward to is a next generation tuberculosis vaccine. And so Gavi and the Global Fund, which has in their mandate tuberculosis, are playing instrumental roles at already signaling to industry that when we have an effective tuberculosis vaccine, there will be interest to finance it. So there's an in-principle decision, and we really are excited at the prospect because TB still represents a tremendous burden, primarily across lower and middle income countries. But the new vaccines that are in the pipeline could avert tremendous morbidity and mortality if rolled out. So let me just summarize the presentation by the following. What we're advocating for in talking about the how of a life course vaccination program is really calling for this to become a social norm, that we stop just thinking about immunization programs as for infants and children. We really are advocating for the appreciation of immunization to be experienced across the life course, across an individual's lifespan. So we need, we have a useful precedent now from the pandemic with a wide rollout of COVID-19. We have a changing paradigm vis-a-vis the population ages as other vaccines are coming in to the market. And we need to advocate and discuss and present to countries the evidence for why these new vaccine introductions should be a priority, and as I mentioned, the economic benefits that they can present, including building on the evidence that exists. We have some evidence, but continuing to develop that evidence will be really important to fully appreciate the benefit of adult vaccination and also for the elderly. And then finally, we are positioning life course immunization very much as a centerpiece for improving the overall quality of health services as part of a broader approach to strengthening primary health care. So with that, I want to conclude, and I also want to mention that as part of this 50th anniversary, the celebration of 50 years of EPI, there is a campaign that this is humanly possible. We have the capacity, we have the evidence, we have what we need to go further and build out this life course immunization. So thank you for your attention. And again, thank you to the Summit for inviting me to present on this important topic.
Thank you very much for that compelling presentation, providing us with a very clear vision of how life course vaccination can transform global health by extending immunization efforts across all regions. Thank you once again. And now, ladies and gentlemen, we would like to take a short break to cool things off a bit. The panel discussion on international cooperation measures to form a healthy vaccine supply chain will proceed at 5:25 p.m. So refreshments are available at the back of the hall, so please do enjoy, and we will see you shortly after the break, so please enjoy. Ladies and gentlemen, welcome back. And we will now begin the final part of the 2024 World Bio Summit special session, the panel discussion. The moderator for this session is Professor Hee Jin Jung, President of the Korean Society of Zoonists and President of Korea University Kudo Hospital. And together with the speakers from the previous presentations and with our three panelists, we will delve deeper into the topic of international cooperation measures to form a healthy vaccine supply chain. So with that, the floor is yours, Professor Jung.
Good evening. I'm Hee-jin Jung from Korea University. It's great honor for me to be chairing the panel discussion during the special session named as Promoting Vaccination for a Safe and Healthy Future, organized by the KDCA at 2024 World Bio Summit, as well as to meet many experts from various countries here in Incheon, Korea. In this session, all speakers and panelists will discuss international cooperation strategies for the establishment of a healthy vaccine supply chain. Before we begin the discussion, let me introduce the panelists. We have 6 panelists today. In addition to the speakers who present earlier, 3 distinguished panelists have joined us. Let me briefly introduce them. Dr. Hoon Sang-ri, Chief Strategy Officer at the Wright Foundation and Adjunct Professor at the Yonsei University, is a global health expert and founding board member of the Korean Society of Global Health. Previously, he advised KOICA on health project and managed immunization programs at Korea CDC. Dr. Anthony Hussar is a program director for capacity building at the IVI's EPIC unit in Seoul. Previously, he was technical director for the Global Health and Moat McDonald, leading Southeast Asia's planning fund grants. A former medical doctor, he also serves as a visiting research fellow at SHTM in Bangkok. The last panelist is Dr. Dong-woo Lee. He is working at KDCA, serving as a divisional director for the National Immunization Program of Korea. He has been working in the front line of the infectious disease outbreak battlefields for a field epidemiologic investigation and response strategy planning to secure the nation's people, including MERS outbreak and COVID-19 pandemic. Before his KDCA appointment, he dedicated himself to the OECD as a senior health economist for enhancing health system resilience of the world during the COVID-19 pandemic period. To ensure the smooth discourse, let me first explain the format of the panel discussion. I will begin with a short opening statement, and then each panelist will have the opportunity to share their opinion in turn. After that, we'll have an additional question and broader discussion times. Okay? Yeah. Yes. Let's begin the session now. Vaccination is the most effective means of preventing disease and stopping their spread, and we have once again realized its importance through our experience with the COVID-19 pandemic. For the world to fully benefit from the impact of vaccination, the equitable distribution of vaccine is crucial. Achieving this requires a shared vision of universal health protection and strengthening global capacities. Moreover, we must go beyond restoring previous vaccination levels and actively consider future challenges such as expanding coverage and inclusivity. To ensure the vaccine equity, it is essential to guarantee both a stable supply of vaccines to all countries and the implementation of strategic vaccination programs. Now, I will ask the common question to all of the panelists. The need and importance of vaccine equity is something that does not need further emphasis. Could you please share what specific effort or plans in your organization have in place to support countries or individuals who are excluded from the benefit of vaccinations? Please talk in order, starting with Dr. Pfizer. Please.
Thank you, Chair. So in order to reach the unreachable, Gavi has launched strategies around it. The first one is to zero dose. I think my colleagues, Lauren and Devi have already highlighted the zero dose children and also the backsliding because of COVID. So Gavi has ramped up support in these two areas. We still have around 10 million zero-dose children around the world, and this figure was 14 million around at least 3-4 years ago. So with Gavi's scaled-up program supporting countries reaching the unreachable using technology, innovative solutions. For example, Gavi has partnership with Zipline, delivering a vaccine through the drones. It started as pilot in Rwanda in 2016, and now it has scaled up to other countries in Africa, and we have a lot of demands on how we can deploy drone delivery to reach the hard-to-reach areas. We also work with our partners, ministries of health and partners on ground to reach the slums and find a solution how the communities in slum areas who are not registered or who do not have access to vaccines through because they are not recognized in the urban centers. So Gavi is working with partners and with ministries of health to register them. In addition, we also digitalizing the immunization system for better record keeping and identifying the areas and in terms of geographic as well as how we scale up program to reach these zero-dose children around the globe. For catch-up, the big catch-up campaign where some countries slided backwards because of COVID or stress on health system, health workers. As you know, the number of countries had huge stress on their system. The health workers were unable to operate. So Gavi has invested more resources into big catch-up campaign to reach communities, children, and adolescents for access to the life-saving vaccines. Thank you.
And from UNICEF side, we're working together with our partners, Gavi, UNICEF, and with other partners, including civil society organizations, in implementing this catch-up, supporting the governments to catch up these children who've missed out on the vaccines during the pandemic. In addition, UNICEF has been supporting countries for decades now on cold chain. I mentioned earlier about the integrity of cold chain is needed to keep the vaccines viable and of good quality. And in addition to Gavi previously supporting the cold chain expansion in countries, COVAX also came in, and with that, many countries were able to be to scale up and expand the cold chain equipment. And it's important because these cold chain need to be closer to the communities that they serve. And this also requires really functioning cold chain, which means monitoring of the temperature. And we're helping countries do that as well in rolling out, for instance, the remote temperature monitoring devices and capacity building of the staff in the governments monitoring this cold chain. As last mile is the most important. So we're looking at the distribution system of the vaccines to these health facilities, how to get them from the health facilities to the communities that they serve is something that we're looking at. And also stock management is very important. You do not have vaccines, you're not going to be able to vaccinate. So real-time monitoring of the vaccine stock in country, both at the national level and the subnational levels, health facility levels becomes really important. And these are also the areas that we're helping countries with. I also mentioned about demand generation, how communities with the COVID and also with the social media, there is some misinformation around. So we're trying to address that by using both the community engagement that UNICEF works in and also social listening. And for demand generation, really using this human-centered design approach from the perspective of the user in tailoring the messages. So those are a few of the things that I can say UNICEF is working on.
Thank you, Chair, for that question. It's a pleasure to join such a strong panel on this important topic. So let me please speak a little bit about the WHO work to address the remaining supply chain issues. We've talked a lot about some of the issues related to availability, affordability, and equitable access. So I wanted to speak again, WHO and the immunization community at large is working on a common agenda. So we have Immunization Agenda 2030. We have the different strategies that relate to Gavi, that relate to UNICEF and WHO as well. And WHO's role therein is really about the convening. So this is about putting people at the center, whether it's at the country level, the regional level, the global level, and making sure that we're convening and coordinating so that the forward motion, the progress is well coordinated. So that's on the agenda and the action that we want to see against the agenda. The next area is around policy. So WHO has a mandate around global immunization policy. So ensuring that countries have strong and clear recommendations for how to use vaccines to mitigate vaccine preventable diseases. And so our strategic advisory group of experts on immunization meets twice a year, and there's numerous working groups that look at upstream vaccine development, looking at the efficacy, looking at how the programs may be designed, really looking at a range of areas from the vaccines themselves to the technologies like cold chain that Devi mentioned. And we also develop the standards, the international standards that determine whether or not these vaccines can be procured in the UN system. So Gavi purchases vaccines that are WHO pre-qualified. And in fact, globally, about 65% of vaccines that are in use are pre-qualified by WHO. So a really important mechanism to ensure the quality and the efficacy and safety of the vaccines in these programs. Related to that, if you go upstream from the pre-qualification, WHO is describing product characteristics. So when R&D is happening, manufacturers actually know what kind of characteristics the vaccines or cold chain need. And this is really useful so that the goalposts are very clear. And if the technology comes to market, that it's clear what they're going to be measured against. So that's with respect to some of the regulatory pieces. I also wanted to say a brief word about the marketplace. So WHO, working with our partners at the Gavi Secretariat, UNICEF, and elsewhere, puts a huge emphasis on market transparency. Faisal presented some data from Korea in particular, but there's a whole stream of work around market shaping that's happening, and it's very much a collective. WHO's contribution is something called the MI4A. It stands for the Market Information for Access Initiative. And basically what it does is enable countries to understand what are the different price points, who are the players, how are vaccines being procured at a global level, and then you can unpack that region by region and vaccine by vaccine. So trying to bring more transparency into the marketplace. And then the last thing that I wanted to mention is the work that we're doing with countries to strengthen decision-making. So how are countries evaluating the options? This is when we're talking about introducing new vaccines. If a government has an additional dollar to spend in health, is it better spent on new vaccine introduction? Is it better spent on strengthening the health system? So supporting countries with decision-making is another really central part of the work that WHO is doing. Thank you.
Thank you very much.
Thank you very much. Thank you for the opportunity to speak today with a distinguished panelist. I think it is quite a rare moment where great minds and colleagues and partner institutions to dialogue on these issues together, especially from Korea and global partners. As for the Right Foundation, we are committed to equitable access for the health technologies such as vaccines. And for this, we support global R&D with very much of an end-to-end approach. From the beginning of R&D, we have very strong focus to have equity in mind from the ideation and development of R&D process. And also, we try to always find partners who will ensure equitable access to the novel vaccines that we develop through global, regional, national public procurement to the last mile to ensure that there would be no zero-dose children and to have no one, to leave no one behind. On the other hand, while we strive to support R&D of a new vaccine with the technologies and innovation that can be helpful to ensure equitable access to vaccine in LMICs to the last miles, especially in the resource-limited context, such as vaccines that are more affordable, thermostable, easy to administer, etc. For example, we are currently supporting research and development of new vaccine technologies such as combination vaccines. One of such examples is hexavalent vaccine, which is being developed by LG Vaccines, LG Chemistry, which we have previously funded. And also, such a combination vaccine can deliver more number of antigens in a single inoculations. Also, we are supporting the development of microneedle array patch vaccines technologies, which can potentially provide easier way for administering the vaccine with a needle and with the lesser needs for the cold chains that are at a more, especially at more fragile health system setting. Lately, there are a lot of geopolitical instability with a lot of refugee situations, which is causing a lot of difficulty for vaccinations. We are currently supporting MR, measles, rubella, microneedle array patch vaccinations. But I think still it would be important to support establishing robust, strong, community-based primary health care bases to deliver vaccine at the last mile, to support strengthening the overall health system, including robust cold chain and supply chain logistic capacity, to accelerate the development use of the digital innovation to better monitor and manage vaccination of all children. So I think we cannot work alone as R&D agencies, but we have to really work closely with all the partners who are present here. Thank you very much.
Thank you for the hosts and for all of the speakers for sharing their insights and presentations earlier. I think one of the things that's very interesting about vaccines and immunizations in general is that it affects, or it requires the whole value chain to come together in order to be able to deliver vaccines successfully in all countries. Dr. Faisal mentioned with the Gavi funding that it looks at both the life science side but also the health system side. And I think it's really important to emphasize how important both sides of this is. At IVI, where I work, the International Vaccine Institute, we have various streams of work that try to address the different sides of this value chain. In the laboratory with vaccines themselves, we are working to try and improve the stability and the scientific makeup of some of the vaccines that already exist, but also try and come up with new ideas. Dr. Hun Seng already mentioned trying to find better ways to deliver vaccines, whether it's through needle patches rather than injections, which make it a lot easier to deliver, but also looking for ways of reducing doses with equal effectiveness, or reducing the instability due to heat so that you don't require such a robust cold chain in order to preserve your vaccines. So all of these different areas in the laboratory, and a lot of them don't end up working, but it's important to keep trying to find ways to improve the vaccines that we already have and to come up with better vaccines in the future. On the more real-world operational side, I think there are several areas. Dr. Devi already mentioned, she put a nice slide up looking at supply side and demand side and regulatory. I think it's important that we don't try and focus on one thing, but actually try and address all the different elements. One area which I think is particularly important and is an area where I work quite a lot in is the capacity development at the national and local level. I think it's important to bring people like us together to agree on frameworks and priorities, but ultimately the delivery of vaccines happens at the site level, at the schools, at clinics, in a lot of places where there aren't too many resources. So it's important to work with countries as well, not least because we need to get around some of the regulatory hurdles that all of the speakers have mentioned. One item for thought, I guess, and this was inspired a little bit by the session this morning on health AI, is where can we use the advance in technology and AI, artificial intelligence, to improve some of these efforts. One potential area that I've been thinking a lot about, I was in a workshop last week in West Africa, and just trying to translate in a workshop between French and English and Portuguese was super, super difficult, and it used up a lot of time. Are there better ways that we can try and cross these hurdles between countries to improve efficiency? And the final point I'd like to make is on research and data. At the International Vaccine Institute, we're a research institute, and there's a lot more work that can be done and should be done looking at how we get research into policy, but also policy into practice. And I think unless you have all these pieces in line, it's very difficult to move the needle a long way in terms of reaching the unreached. Thank you.
Thank you, Chair. I think that I heard that many of my colleagues talking about the global level of the how to people is not excluded from the vaccination. But the reason why I'm here is because to share about our kind of national level effort to how to enhance the accessibility of the vaccination programs. First of all, I think that the strengths of the national immunization program, such as our countries, that is to get rid of the financial barriers. I think that is one of the key elements that we can enhance the accessibility of the vaccine. So since kind of some 2009, I don't exactly remember that, but we started kind of this NIP program with co-payment kind of thing. So every people should pay some amount of money when they get vaccinated. But we try to kind of expand our coverage, both coverage and kind of that kind of co-payment system. Then we selected lower and lower the burden of the payment of the people. Then finally, we are now completely free of charge of the whole vaccination if it is included in the national immunization program. So I think that is the one key element that we succeed to increasing accessibility for the vaccination. And second thing is kind of the physical accessibility. In Korea, we are very highly privatized, almost 80% over. The clinics and hospitals are private owned. So it is very essential to ensure how people's not only to kind of the public health centers, but also can go to the private hospitals and clinics to get vaccinated. So we are always committed to kind of increase about kind of some cooperations between government and the private hospitals through the kind of some close communications, that kind of some medical society or something. We always to try to expand our the accessible hospitals and clinics all around our country for the peoples to get vaccinated in rural or remote area also. But with this kind of two element, it is not enough to kind of the people to come to the vaccination site itself. So we always recognize the crucial element is kind of enhancing the awareness of the people by kind of education or kind of some campaigning something. So we are strongly collaborated with our other ministry, including some Ministry of Education, to enhancing the awareness of the child themselves and also their parents by sending some kind of some messages or always kind of advertisement through the many schools or kind of caregiving facilities. And also we are now sensing that some very slight decrease of the vaccination rate. So now we are planning about how to figure out some the weakness point of our people. So we are kind of planning kind of some vaccination confidence survey of something to figure out what's going on or what is wrong or what we are not fully satisfying our people to be vaccinated. So that kind of some efforts in harmonizing the national level is kind of very crucial to improve and leave no one behind. It's very, very big dreams, but no one behind of our people in our country is kind of it's kind of national level efforts. Thank you, Chair.
Thank you very much for all of you for your insightful comments. Based on opinions of panelists, I think in order to ensure the vaccine equity, it is crucial to diversify vaccine supply chains, including vaccine sovereignty, and ensure the safe and proper distribution of procured vaccines through the well-established community-based primary healthcare systems, and implement stable vaccination policies. These elements are fundamental to achieving comprehensive and equitable vaccination coverage. And then I would like to suggest that we further deliberate on the topic of healthy market shaping and diversifying the vaccine supplies, as it could provide important insight into strengthening the resilience and equity of global vaccine distribution systems. I believe the good news on the Gavi homepage, the Gavi have a plan about the African vaccine manufacturing accelerator programs, and I think that is very good news for the African or Asian countries where the vaccination rate is low. So do you introduce the programs to the audience?
Yes. Thank you, Chair, again. So as I mentioned in my earlier presentation today, one of the key pillars of Gavi's work is vaccine market shaping, where we pool countries' demand, we take this demand to vaccine manufacturers, we negotiate prices and make it affordable. Though Gavi is supported by donors, but as I mentioned earlier today, every country has to co-finance. So it should be affordable for low-income countries. So in order to, and I also mentioned, if I could remind, we had 5 manufacturers in 2001, and now we have 19 WHO pre-qualified manufacturers around the globe. But still there is more need and demand. So as part of learning from COVID, Gavi has now launched a regional vaccine manufacturing initiative. To be honest, it will be regional mostly for Africa, and where Chair kindly mentioned that we have this, we launched on 2nd or 20th June this year, African Vaccine Manufacturing Accelerator. It's an innovative financing facility to promote vaccine manufacturing in Africa. It's a continent of world's 20% population, but only manufactures 0.1% of global vaccine supply. So this facility, backed by 7 donors of $1.2 billion over the next 10 years, will incentivize manufacturers in Africa, either government, private sector, or public-private sector partnership, We have already launched the call for expression of interest from interested manufacturers. We have already defined at least 7 vaccines which are high in demand for Africa, and even when they are ready could be exported. So African Union, we must appreciate their, it was their idea and initiative which Gavi and donors and other stakeholders are fully supporting. So African Union has this ambitious plan of producing 60% of Africa's needs at least by 2040. So through these facilities of $1.2 billion, there is we can call it a reward money for the successful vaccine manufacturer or the first past the line through WHO pre-qualification. Gavi will invest some resources, and as a second stage, we will subsidize the prices. We do acknowledge that vaccine is quite expensive venture, and private sector, especially even government, they have to offset the loans or financing facilities or financing for those investments. So Gavi, in order to match the global price, Gavi will incentivize the vaccines manufactured through this facility over the next 10 years. We do not have other regional initiatives like for Asia or Latin America, but on case-to-case basis, we do encourage and support other potential vaccine manufacturers in different parts of the world. Thank you, Chair.
Thank you very much. Is there any comments or to this topic? Moon-sang?
Actually, listening to other panelists, I wanted to highlight some additional activities that Right Foundation has been funding, which can contribute for the more equitable vaccine access. One is actually tech transfer. Actually, we also fund the vaccine manufacturing training for the local vaccine manufacturing capacity building, but it is all toward really the goal of establishing local vaccine manufacturing capacity in LMICs. Toward that goal, we just recently announced our approval of a grant for tech transfer from Korean vaccine manufacturer Ubiologics to BioVac in South Africa for meningitis vaccines. So I think a tech transfer can be one of the way to contribute for the equitable vaccine access. We do not want to limit it to Africa. We are very open to work with any willing Korean vaccine manufacturing partners to make such a tech transfer in Asia and Latin America as well. Another aspect which we actually are funding is evidence generations. One area that we have our keen eye on is for if there is any kind of vaccine that had been already developed, which is near the licensure or already have a WHO PQ, but we had been thinking that if there can be locally produced evidence data for such a new vaccines, which can, so that with this evidence or data that had been locally produced for that continent or certain specific continent or specific countries, then might accelerate introduction of such a vaccines into their national policies, rather than just based on the data that have been available in other continents or other countries. Lastly, actually, we recently funded some IT digital related innovation in vaccines delivery or vaccine program management, like digital-based vaccine registration programs or vaccinations status tracking through the digital health data solution with the mobile mobile device-based health data reporting. So I hope all of this approach can also, through supporting such a research, I hope this can also contribute to the equitable vaccine access. Thank you.
Thank you.
Yeah, thank you for that. And I'd like to add 1 or 2 points related to the question from the WHO perspective. The first is something that was mentioned in the opening ceremony by the DG when he was talking about the global training hub for biomanufacturing. So this is an MOU between WHO and the government of Korea to build the capacity to produce of a workforce that can produce not just vaccines, but vaccines as well as other biological products, including cancer medicines and the like. So this is a really important undertaking to build that capacity and build out the workforce that can therefore contribute to regionalization of manufacturing. The second thing that I wanted to add as well is, there's the tech transfer element, which is critically important. There's the workforce piece as well. Part of that also speaks to the regulatory environment in the country. And so one of the big areas of focus for WHO is, we've talked about pre-qualification, which is a global mechanism, but in order for localization of manufacturing to really take off, we need to strengthen the country's regulatory authority. And so WHO does a lot of capacity building, a lot of trainings to increase the regulatory capacity of countries so that they are considered high functioning. And just to further clarify, when a country needs to import a vaccine, their regulatory authority has to function at a certain level. But for them to be a vaccine manufacturer, the regulatory authority has to be at a higher level of functioning, and especially if they look to the future for exporting the vaccine. So this is a major part of WHO's work to build out the capacity for regional manufacturing, building the capacity of regulatory authorities. Thanks.
Thank you very much. Any other comments? Okay.
This point is perhaps a little bit wider. It's not just diverse supply chains, but it's thinking about the approval part of the regulatory process and clinical trials. So I think for a lot of diseases, they're global and the trials can be conducted in several places. But there's been some talk at this summit already about pandemic preparedness. And several of those diseases may only occur in some countries, certainly in the initial stages. And it's about trying to build, I think this continues from Lauren's point, it's about building capacity at the country level so that they can also conduct the clinical trials. And quite often, it's too late to wait until there is an outbreak. You have to have these places ready in advance. They might not have clinical trials to do, but you can build up research capacity. You can train them to do community engagement. There are several things that can be done as part of the diversification process. And I think these are all things that we need to think about. Thank you, Chair.
Thank you very much. Now let's move on to life course vaccination, next topic of discussion. Okay. Given the growing emphasis on the importance of lifelong immunization, what strategies do you think are most effective in promoting vaccination among the adults and the elderly people? Debbie?
Thank you. So I think COVID has given us a lot of lessons in reaching the elderly and the population outside of the usual immunization schedule. And even before COVID, there were countries, as Lauren mentioned, who had already introduced flu vaccines, seasonal flu vaccines for the elderly, for the healthcare workers. So with using really these lessons learned and the platforms that have been rolled out for this population, we should continue to promote this life course approach. And as Lauren has shown, there are many vaccines coming up in the future as well. The trick is also promoting them, generating demand in the sense that they know the benefit. The governments know the benefit, and they have the finances to procure and provide those vaccines. And also for the community, the elderly, the health workers, those with comorbidities, the pregnant women, for all of them to know the benefit that these vaccines are bringing to them. And that's going to require a really good communication strategy, advocacy, and looking at also what UNICEF is doing, the what's called BEST behavior and social drivers of immunization. So not only for children, but as the vaccines are now being given for other age groups, what's driving them to get the vaccines or not? So looking at those details and doing the analysis would provide information to better tailor the messages, better tailor the interventions for this population to come and get the vaccines as well. And in addition, Lauren also talked about, for instance, in Cambodia, the integrated intervention. When you're giving COVID vaccine, it was done together with the interventions for non-communicable disease, so measuring the blood pressure, the glucose level. So looking beyond, I also mentioned this, looking beyond immunization itself, but providing other services that cater to the needs of that specific population is going to be important, and that will require capacitating the healthcare workers to be community healthcare workers to be able to do this, as well as strengthening the other aspects of the primary healthcare.
Thank you very much for your very clear comments. And who is next comment? And then, yes, please.
If there is no one else. Maybe less from Right Foundation's perspective, but this might be a little bit of my personal take on this. I think we really need to take a look at the needs to cater the demands for adult vaccinations, even in LMICs. I think we have seen through the COVID-19, adult vaccination maybe now is no longer a luxury. Many of the COVID-19 casualties were taking place in older generation, older aged populations. So maybe it is time to go beyond focusing only on the under 5 strata age group of populations, but take a look at the importance of adult vaccinations. And also for this, actually, I'm looking at Gavi. If Gavi can take a little bit more proactive role in not just taking a look at mortality as a measure, but to bring in morbidity into vaccine policy prioritizations metrics. I think that might require discussion with the WHO as well. So when we solely focus on the mortalities, I think adult vaccinations and some vaccination program that might benefit in terms of morbidity might be not well prioritized. So I think we need more proactive role to look beyond that aspect. And also, so I think the vaccines such as seasonal flu vaccines and other adult vaccines that are highly in demand. I have heard from many Asian countries and from Latin American countries, and even from many African countries. Through COVID-19 pandemic, it was, I think, the first time many of those countries had to deal with adult vaccinees populations. And I think this can be one of the window of opportunity that we can really work with those older age population groups so that they can be included in vaccinations program of the countries and truly have it as a approach of leaving no one behind. Thank you.
Thank you. Okay, Lauren, please.
Very quickly,
Yes.
I think our vaccine investment strategy framework encompasses the global health security as one of the key area to look into, eligibility, equality, and social justice. I need glasses. Economic burden, mortality, and morbidity. So while looking into any new vaccine, these are the key framework criteria Gavi considers before launching any underused or new vaccines for LMICs.
I've already spoken for about 20 minutes on life course, so I'm hesitant to say anything else, but I did want to put out one or two other things that didn't come up earlier. One has to do with the role of vaccines in the fight against antimicrobial resistance. So as we think about adult immunization, yes, it's about protecting health. I had the one slide about individual and community and health system, but it's also about AMR too. Increasingly, we're seeing vaccines as a tool to fight against antimicrobial resistance. So I wanted to add that. And then the other point I wanted to make, because I think these days you can't have a discussion about health without having a discussion about the climate and how we're seeing events, either climate events or vectors changing. And so I think the role of adult immunization and life course immunization will also be shifting as we're seeing the impact of climate change. So I just wanted to add those 2 points. Thanks.
Thank you. The lifelong vaccination is very important, such as catch-up vaccination and vaccination at the high-risk group. But even though that there are still countries where the childhood immunization is still significantly lagging behind. So the minimized number of those children is like the immediate goal rather than focusing on the vaccinations. So while the key factors may differ from countries to countries, what do you think is the most common and the critical hurdles? So is there a need for country-specific strategies, or should we focus on identifying and managing the most at-risk countries? How do you think about that?
I can take this as well. So I think in my presentation, I presented about both the supply barriers, demand barriers, and more increasingly, the conflict and fragile situations as well, where this number, the number of zero-dose children, many are found in many of the conflict and fragile countries. It is difficult to pinpoint what to work on globally. It really depends on the country context. And we should be looking at the country context. Even further beyond, we should be looking at the subnational country context. In some countries, maybe the coverages are going down and routine immunizations suffering because they're having problems with procurement of vaccines. So they're facing stockouts. In another country, they may be having vaccine hesitancy issues, but it may be also localized and not the entire country. So in that instance, we'll be working on that area for vaccine hesitancy. And in other areas, what are the actual issues that are prohibiting children or others from getting vaccinated? So that really analysis and look at the local level becomes very important to see what's the barrier and the obstacle, and then tailoring the interventions according to the problems that they're facing. So I think that's, in a nutshell, I think it's hard to say there's one size fits all, but really looking down at the subnational, local level.
This follows from Devi's point a little bit, but I think one area we haven't touched on too much is the data available on vaccinations and immunizations. And this is all part of the health system, but in order to do monitoring, evaluation, and research, we need the information. And it's an area where I think there are still plenty of gaps in the system, especially in low and middle income countries.
Thank you again, Chair, for the question. I would just add, not wanting to repeat what's already been said, I would just add this is also where investments in disease surveillance are really important. So ensuring that countries have adequately functioning disease surveillance systems to rapidly detect, for example, cases of measles, paralysis in the case of polio, So this is a really important element to then further tailor. And I would also advocate for a really strong emphasis on the use of the risk assessment tools that exist. So we can predict, and AI is a bit of a theme of today. AI is a really powerful tool also to predict where we may see disease outbreaks, VPDs in particular. So using some of these tools, I think, could be a really important ingredient to tailor and come up with country-specific strategies. And the last thing I would say is this is also where I see a very significant role for diagnostics. Gavi has done a lot of investments in diagnostics, and there's a lot of work that still remains to be done to roll out the tools that we have. But I just wanted to add those few points.
I just wanted to echo my thoughts on what the WHO colleague has said. Actually, in Korea, Korea's national immunization program is not just NIP, but NIP and BPD control. And actually, I myself worked 14 years ago at Korea's national immunization program and BPD control. And one of the there were two aspects. Strong national immunization program delivery and management operations, but also very robust VPD surveillance and response activities. And I think for many of the much of the years, that had been somewhat of a luxury for the high-income countries. But I think there are a lot of digital innovations and many of the tools and upward level of the capacity building, and also the needs to strengthen the vaccine preventative disease, disease surveillance and response capacities, which I think can strengthen the aspect of the data elements in the countries, and also which I think can contribute to the goal of the preventing the zero-dose children.
Thank you very much. We have a time limit, so it is better to discuss the final topics. One of the key points in the issue of vaccine equity is the preparedness for the next pandemics. So the COVID-19 pandemic has highlighted and the pressing need for global collaboration in preparing for the next pandemic. To achieve this, it seems crucial to restore the vaccination rates first that have been declined since COVID-19 pandemic. So what do you think is most important priority for boosting vaccination efforts in the current situations? So Dong-ri, please share your opinion in Korean situation.
Thank you, Chair. Yeah, as I mentioned before briefly, that it is we are looking at kind of some. Oh. Yep, it's okay.
Mic is dropped.
Yeah, we are confronting kind of some hesitancy after COVID-19. Korea has kind of showed very high rate of the vaccination rate before COVID-19. Some vaccines almost 95, 98, but it is slightly decreasing both for the child and kind of some other the older age, both kind of very slight. But it never happened in Korea. So the COVID-19 experience gives me both opportunity for us, but very big challenge for us as a kind of some launching vaccination programs. The mRNA vaccine for the COVID-19 is kind of showed us that the vaccine can be vaccine production can be facilitated with this kind of developed technology. We can make it more faster and more rapid way to respond about that kind of some health emergencies in a like pandemic, but also but people who is very familiar with the classic vaccination program, which is stabilized through the over several decades of history, that it is very trustful and we are very safe from the vaccination, attacked by some cases of the side effects, strong side effects, or kind of some death cases, fatal cases, the dismantling about the belief about vaccination program. So for the next pandemic, I think that it's very important to rebuilding the trust of the vaccination program itself. And I think that it's kind of very crucial. It's very textbook-wise statement, but kind of through the transparent communication based on our kind of some information or data or evidences we can, as much as we can have, to timely and transparent communication with the public is the top priority to rebuild this kind of trust, to make them boosting up the vaccination among the public in the nation level, but also in the global levels. Thank you.
Thank you. Is there any? Okay, Debbie.
I just want to continue on from what was said about rebuilding the trust in the healthcare system and the immunization program. I think it's important to do things in parallel, so it's not one exclusive of the other. We do need to catch up children who missed out, because there is a large number, and without catching them up, countries risk a huge outbreak of vaccine-preventable diseases. So this is important to do. And in parallel, we do believe that strengthening the primary healthcare is the backbone for resilience. And this includes rebuilding trust in the immunization program. We need to equip our community health workers who are day-to-day in touch with the community to have that confidence in immunization vaccine again. And this includes really building their capacity with interpersonal communication. Oftentimes, you would see immunization happening without the caregiver knowing what the vaccine is, what it is for. So it's important for them to communicate the importance of that. So really focusing on the community healthcare workers, building their capacity, and remunerating them, bringing them into the formal health system as well. And another one is the focus, as I mentioned earlier, on the primary healthcare. So it's not just the healthcare workers, but also the infrastructure, building the community's confidence and trust in the health facility itself. Are they going to a health facility where there are no wash facilities, where there's no running water? So that experience also becomes important, and build that trust in the health facility themselves and other aspects of primary healthcare, so that immunization doesn't stand as an alone, but as part of the whole health system and being able to deliver the other services that's needed. And as such, building that resilient health system that we so wish before the next pandemic.
Thank you. One comment more.
So I think, WHO in our normative and policy making role after this most recent pandemic really set to work in providing stronger, clearer, better guidance on health emergency preparedness. And I wanted to just say a word about what exists. And there's still a lot of work to be done, and a lot of partners are looking at this, but there is now updated guidance on strengthening health emergency prevention, preparedness, response, and resilience. For short, we call it HEPR. And HEPR has promoted or socialize what we call the 5 C's. So I thought maybe just in response to your question, I could briefly summarize the 5 C's. So the first has to do with what I've already mentioned, which is surveillance, collaborative surveillance. That's the first C. Community protection. I think Devi just spoke to the community element, but really thinking about at a community level, what are the messages? What are the resources? How do we organize? The next C is care. And when we talk about care, we're talking about safe and scalable care. So to the extent that that is possible, that there are therapeutics, that should be scaled as much as possible. access to countermeasures. This is where immunization comes in. So the fourth C is countermeasures. And then the last one is coordination, emergency coordination. And I wanted to maybe spend a little bit more time on that because I think if we were to look back at the COVID-19 pandemic, coordination at a global scale was there. But I think as we look ahead to potential future pandemics, we're really looking at what are the regional mechanisms for coordination. In a country level, you have the EOC, the Emergency Operations Center. So there's good infrastructure that's being developed at the country level. At the regional level, there is a need to go a bit further. So I wanted to just outline some of that. And I think part of this, what's implied here too, and someone else may wish to say something, but the financing element, we lost a lot of time in the pandemic and the COVID pandemic while we were waiting for financing to be lined up. And one of the things that Gavi has done tremendously is set up a day zero financing facility so that if there is another pandemic, and I think many experts will say not if but when, so maybe I should say when there is the next pandemic, that we have the financing ready to go on day zero so that we can start developing a vaccine that can play a role. Thank you.
Thank you. 3 minutes left to the end of this session, so I'd like to wrap up of this panel discussion. Based on the discussion of panelists, I think the management and control of vaccine-preventable infectious disease can be broadly categorized into 2 key areas. The first emphasizes the importance of ongoing management rather than solely focusing on the response to the pandemic or new pathogens. This includes addressing how to improve the completeness of routine childhood immunizations and how to minimize vaccine inequity, both in terms of countries and population. The second area highlights the need for international efforts to rapidly strengthening support for the countries with limited access to the vaccines, or to promote vaccine sovereignty in response to new pandemic situations. I would like the experts thank you and express my gratitude to all the experts, to the audience. Thank you very much.
Yes, thank you, moderator, for skillfully facilitating the panel discussion. And thank you, panelists, for sharing your very thought-provoking insights with us. Thank you once again. Ladies and gentlemen, another big round of applause, please. Thank you. Now, ladies and gentlemen, this brings us to the end of the 2024 World Bio Summit special session. We would like to extend a heartfelt appreciation to all of our distinguished guests and attendees for attending today's special session, both in person and online. We would like to once again thank you very much for your excellent contribution and support. Now, the 2024 World Bio Summit will continue until tomorrow, so we look forward to your active support and participation. Thank you very much, and have a wonderful evening.